Happy Wednesday. Happy Wednesday. Happy Wednesday, everybody. This is Tevra Francis, the publisher of NJ in Color, and we are here with a pop up NJ in Color Live. It's a great day. It's a beautiful day. I hope you guys are getting able to enjoy the sunshine, enjoy this beautiful week that we're having. It's not raining. We can see the sun, which is always a great thing. We're here today to talk about health, and you see I'm wearing my pink shirt because it is Breast Cancer Awareness Month. And we have some friends that are going to come on and talk to us about what they're doing to promote healthy living, healthy habits, and health screenings and all of that good stuff here in North Jersey, specifically to the Englewood, Bergen County area. Before we get started, I just want to remind you that we are always sharing information. We are perfecting the way that we receive events. So if you have an event coming up, go to our website, go to calendar, and you'll see that there's a button now where you can submit your events online via a form so that I can see them and I help you promote more appropriately. Also, I just want to give a huge thank you to everyone who donated to our fifth annual Back to School Drive. We had a lot of fantastic donations from some of our family, our friends, fellow business owners. A special shout out to the Tammy Felton State Farm Agency, to Having Our Say, Shantae Glover Jones, to Crystal Burns, Realtor for Coldwell Banker. Who else? Oh, Bloom Empowerment, our friends at Bloom Empowerment for Women, Jackie Fernandez and her team. We had so many things, coffee and cornbread, and so many others. So I just want to thank everybody for their donations. They have been distributed. And there's one more drop off that I have to make to Greater Bergen Community Action. But thank you guys for giving. And we'll be back again for the holiday season. But I just want to thank you all the kids that you are affecting with your help and your giving. They appreciate it as well. So with that note, we're going to go into our community and talk to some of our friends. One of our friends, you guys know her. Her name is Danielle Hadnott. And she is my actual partner in sharing a lot of the fun times that we have all throughout North Jersey. She is a photographer and a creative by day, but also she is the president of the Hadnott Foundation, which services the North Jersey community as well. So, Danny, I want to welcome you again, formally now,
Thank you.
on NJ Color Live. And we are talking about the Englewood Fall Health Festival, Fall Health Fair, that's going to be on October 8th in Depot Square Park in Englewood, New Jersey. That's on a Sunday. So you're going to tell us about what you're doing, and we're going to bring on some of your co-hosts.
Yeah, so just to really quickly, just talk a little bit about the Hadnott Foundation. We started in 2000, and we really it was created in response to a loss from my stepmother. She was a banker at Chemical Bank. So her job was actually to work with foundations like us to help them get funding. And she was, definitely dedicated to that. And what we wanted to do was just to make sure we honored her. And we created this foundation with my dad, Benny Hadnott. He's retired now. He was a CPA for many years, one of the largest Black-owned CPA firms in the country. He decided to go out because he didn't want another person to experience the loss that we had. And she really fought valiantly. She was in some trials at Sloan Memorial Kettering and was better, but it was honestly the trials, and that was what we wanted to try to help avoid. So what we've tried to do since then is focus on healthy living, taking control of your own health, doing the things that will help you prevent even getting cancer. So that's where we try to focus. And that was one of the things that we do is we host these health fairs. So we usually partner. And in this instance, for this health fair, we're partnering with the Englewood, New Jersey Department of Health. And we are coming together. We're bringing screening vans. Susy from the Department of Health will speak about those specifically, but we'll definitely have flu vaccines, things like that out there, and then just bringing out and focusing on breast cancer because this is Breast Cancer Awareness Month.
Mhm.
So we will have breast cancer advocates, warriors, survivors. We will honor some people. We'll have some people out speaking,
Mhm.
and just really an opportunity to get out and find out information.
Mhm.
And to keep it bright and upbeat, we decided to, at the same time, because this is also Hispanic Heritage Month, to
Mhm.
bring in some of the great cuisines, the culture. So we'll have dancers and music and food also. So it will
Okay.
definitely be an uplifting event.
Awesome. So let's put a pin in that, and we're going to bring in Susy
Yeah.
Rodriquez. Hi, Susy. Can you hear us?
Yes.
Thank
Hi.
you
Hi,
for coming.
everyone.
Thank you for coming. So we're just getting into the discussion about the fair itself, but Danny mentioned the partnership with Englewood Health Department. So just tell us what you do over there quickly, and what you're anticipating as far as this upcoming event on October 8th is concerned.
Sure, of course. So I'm the local health outreach coordinator of the Englewood Health Department. So we're a local health department, which we're part of the city. Our role and our purpose is to protect and promote the public's health. So with that in mind, we want to address all of the social determinants of health that we can by providing the services, which is why we've teamed up with all of these organizations to provide this not only to the community in Englewood, but also to all of Bergen County. As Danielle had mentioned, we have over 70 organizations that have partnered up with us to offer this, to be a part of this health fair.
Mhm.
Among those, we have 6 mobile units, screening mobile units that'll be offering free health screenings. So that'll be the Holy Name mobile unit, the Air Express mobile unit from Hackensack University Medical Center, Team Management 2000, Horizon Blue Cross Blue Shield, Buddies in New Jersey,
Mhm.
and then as well as the Mount Sinai Prostate Mobile Unit as well.
Oh, wow.
And amongst that as well, our department, the Englewood Health Department, will have a walk-up vaccine service, kind of like a clinic area
Mhm.
for anyone that is interested in getting their flu vaccine. Regardless whether you have insurance or not, you'll be able to leave the fair vaccinated the day of.
Okay, that's awesome. That's good news. And I know a few of the people from the bands that you mentioned, the Team Management 2000 band, that's mental health, and the Buddies of New Jersey, that's HIV, AIDS awareness, prevention, and resources, correct?
Yeah, so Buddies of New Jersey will be offering HIV, STD, and STI screening, and along that, they'll be offering a $10 gift card for anyone that completes the entire screening.
Awesome.
The Team Management 2000 will offer HIV, hepatitis C, blood BMI checks, blood pressure measurements, as well as glucose screenings as well. And then we have the Air Express Asthma Mobile Unit that will be doing lung screenings, asthma, allergy, immunology information, and smoking cessation. And then the Holy Name Mobile Unit will have breast health and cancer awareness and insurance counseling.
Wow. So we can really just come and like have a full physical in the park almost.
Yeah, and just to add a little icing on the cake, Danielle and I also really wanted to bring out, we'll have a doctor's table. So part of the purpose of that is that we're going to have different doctors from different ethnicities that speak different languages and of different specialties that'll be there and readily available to anyone that might have a barrier, whether it's with their language or culture. They might be able to find a provider that they can relate to there during the fair.
And that's, you know what, that's so important. As I bring on Dr. Marion Bobb-McKoy, that's one of the things that prevent people from getting their regular preventive care is because of fear of doctors, fear of not being understood, lack of access to people that look like them. So welcome to Dr. Marion Bobb-McKoy.
Hello.
Hi. So like I said earlier, I'm going to cry real tears because you were my actual doctor, and I'm going to make you my doctor once again. He left me, y'all. I don't know what to do.
Hello, everyone.
Yeah, so we're introducing everybody. Well, we were just talking about the doctor's table, and there's going to be at the health fair, there's going to be doctors of multiple ethnicities. So to that point, Give us a quick bio about yourself. What made you get into medicine, and what do you expect to be able to achieve through this health fair this weekend?
Well, my background is Caribbean, and I went to school in New York for all of my education. I grew up in Brooklyn. I went to school in New York for all of my education, and I have a very special affinity for the diseases affecting people of color, especially African American descent. So I'm a champion for women's health, especially when it comes to breast cancer, because we and women of color tend to get breast cancer a lot more aggressively when we do get it. And part of my role in this practice at All Health, where I am now, is to, one, encourage women to examine their breasts so they know what their breasts feel like, so they know that if there's a change, to come running to me to get it examined. The importance of women's health and even men's health. Many times the women will come to me first, and then they drag their men behind. So part of my role is to get people in to get their physicals, their annual physicals, because we as a people usually do not come to the doctor unless we're sick. So I'm trying to change that mindset as a family physician into having your annual physicals, your yearly exams. We can pick up a lot and avoid a lot of long-term consequences of chronic diseases.
You were talking about how, again, men and different, age groups, we don't feel like we need to go to the doctor as often. We don't need to go every year. We don't need a family doctor. People are happy with going to the ER when they need something. Can you talk to why it's important to make a relationship with a medical professional? And I think even Susy, you can kind of probably speak to that as well. But how important is it for people to have a relationship with the medical professionals in their area?
It's extremely important for many reasons. One, again, is to confirm whether you're on the right track with what you're doing. Two is to demystify things that people may be doing or thinking. There is a lot of information out there on social media that is incorrect, that can actually harm people. And I think in having annual exams and just speaking to physicians or primary care providers about what they're doing and whether it's harmful or helpful for them. Many people think that they really want to do the right thing. They think they're doing the right thing, but they actually may be harming themselves. That's another reason why to establish yourself with a primary care doctor. The other thing is, over time, we can see if there are any changes and nip things early in the bud. For family medicine, it's a lot about preventative care. Yes, I do chronic care management, but I'd rather help prevent you from getting something than treat you for it. So primary care is really what I'm all about in working with patients to maintain their health even with chronic diseases, but also to prevent those diseases from happening in the first place.
Susy, to this point, Englewood is very diverse. It's a very diverse community. You serve several different groups of people. How do you navigate being able to reach the people and get information about preventative care or resources for medical care to all of the various communities? You have so many different types of economic backgrounds, language barriers, and otherwise. How do you guys navigate that at the health department of Englewood?
So we really focus on making sure that we have the material readable in their language and as well as understandable, which is key. A lot of the things that we focus on is re-educating as we're doing our outreach in Englewood and building the trust, right? I think that that's very essential as well. You have to feel like you can trust someone in order to take their advice and go somewhere. So once you have the trust, and I can say, hey, for example, I have a great doctor, Dr. Bobb-McKoy. She works here. Please see her. The likelihood of them calling to make an appointment is much higher than just giving them a piece of paper and not building that trust.
Unmute myself. I'm sorry. So, Danny, let me bring you back in. We had some sound issues. Let me see if I can get you back on. Okay. So, Danny, in working with Dr. Bobb-McKoy and the Englewood Health Department, what are some of the things you've learned in this journey of bringing this festival to Englewood?
Well, what I have learned is that there's so much information out there. And to echo Dr. Bobb-McKoy, sometimes you need some help to navigate what's right for you, what may not be right for you. And I think that's the part where we're happy that we're having in a doctor's corner, where we're going to have actual doctors there to speak to some of the attendees, to really answer questions. Because I think a lot of times people don't go to the doctor, or they feel intimidated when they're at the doctor. So we wanted to create a more like friendly, relaxed environment so that you could talk about the questions that you have. And I think the biggest thing, especially I think Susy and I really found this out, is there's so many people that want to share their information. It's just finding the right avenue, the right way to get that information out. And sometimes it's just, not enough about with social media. You need like in person, you need to be able to be there and speak to people. And I think that the response we've gotten has been so positive that we just really wanted to, include everyone and really try to get so much, key information. We have people that have started their own foundations because they haven't had information. So they are also out there. We have an organization from New York called Afro Pink. She specifically talks and speaks to Black women with breast cancer, talking about prevention, similar to us, but she does it in her own way. And we're loving to have all these people there because they'll be able to touch someone in different ways.
Awesome. So, Dr. Bobb-McKoy, again, it is Breast Cancer Awareness Month, and you, along with being a family physician, you also work in a little bit of weight management. I know this for a fact because, like I said, she was my doctor, and you would be probably ashamed. And I'll slap my own hand now. All our hard work, just anyway. But can you talk about like how weight management correlates or is important to the prevention of different cancers, breast cancer in particular? Can you talk about that? And before you start, for those watching, if you have questions, go ahead and put them in the chat. Hopefully I'll be able to see them and I can ask them. This is your chance to talk to the doctor directly, ask her what you need to ask. And you can also ask questions to Danny and Susy about this weekend's event or the services that are going to be provided hereafter. But Dr. McKoy, do you have your thoughts, please?
Yes, I'm here. So as far as weight management, All Health Medical Group, we do a lot of weight management, medical weight management. So part of that is when you see what happens to people physically and emotionally once they can see that they've lost a tremendous amount of weight, how that impacts their spirit and their mood, that alone makes a difference in their healthcare, because then people will start exercising, then they will start eating correctly, but sometimes the weight has to come off first. And sometimes people have that barrier of not being able to lose weight for whatever reason, whether it be a medical reason. And we know that there are hormonal reasons why people cannot lose weight. Besides the thyroid, we know that in the gut that there are certain things that prevent people from losing weight. And we have medication that we can tap into that. And once they see that weight comes off, it motivates people. And we also know that over a certain body mass in and of itself is an increased risk factor for many cancers, for heart disease, for diabetes, for all of the common diseases that we see out there. So if we can decrease the obesity epidemic that's rampant in the United States. If we can help to do that, definitely we will see diseases come down. Because if you look at studies, you've seen over the years, as the obesity rate has gone up, so have diseases. So have chronic diseases. So have orthopedic diseases, diseases of the hips, the knees, the ankles, all of your weight-bearing joints.
Mm-hmm.
And so it's a vicious cycle. The less you move, the less you move. And then the weight comes on and on and on. So people, even people who can't move, can lose weight. So we are an advocate, and a big part of all health practice is doing medical weight loss. I do both. I do the medical weight loss and, chronic care management and family medicine, since I'm so broad in what I can do.
Mm-hmm.
And I see people 12 years old and up. So I also take care of children and adolescents with obesity also,
Mm-hmm.
which is it's growing. It's a growing sector in that obesity challenge.
Mm-hmm.
But it has been eye-opening for me and for many patients to see the progress that many people have made, and the joy in that. And that's family medicine is all about, also looking at the end and seeing the results and seeing the hard work of our patients doing the work to get to where they need to be.
Awesome. And also, just asking for a friend, what are your thoughts on bariatric measures for weight loss? Just really quickly.
Yeah, there comes a point sometimes where you our hands are tied. We've tried everything, and still things aren't working. And yes, if a patient is above a certain body mass index, we do have that conversation about bariatric surgery, actually surgery for weight loss. But again, it's not the panacea. You have to put in the work, because if you don't, the weight will come back. So I approach weight loss as a three-legged stool. So it's either medication or surgery, exercise, and the dietary component. All three have to be in play for it to be successful long-term. We're not looking at short-term. We're looking at it for the long-term for your health.
Okay. All right. That was for me, guys. I'm the friend. Okay. So let me unmute everybody. So this weekend is going to be, oh wait, it just, Susy, unmute yourself if you can, please. So with this weekend, there's going to be live salsa. I'm looking forward to that. Face painting, healthcare, 40 and over double Dutch. Oh my goodness.
We have the 40 and over double Dutch group coming from Plainfield. Yes.
Nice. So quickly tell us what each of your groups are bringing to the event that we can look forward to. Susy, we'll start with you.
Sure. So one of the other presentations that we're going to have amongst the many is actually Chef Anthony from the Shervin-Libwell Center, which is just opened up right here on Palisades Avenue. He's going to do a food demonstration in both English and Spanish. So he'll just be going over kind of like what we can do. The specific dish we'll find out the day of, but he'll be there providing that. We brought in most of all of the nonprofits and resources that we have in Englewood that provide information and outreach to the community here as well as outside of Englewood.
Okay.
Along with, I also wanted to mention, along with the doctor's table, we are also going to have advanced practice providers. They also do see patients like nurse practitioners and physician assistants. So it's also important to have them there as well with the doctors at the table, since they also provide care.
Okay. Danny?
Yes. So what I definitely wanted to focus on is the prevention aspect. I think that one of the things that Hadnott Foundation really stresses is about prevention, and that's where we're bringing in different organizations that will specifically talking about stress management. We're going to have Latifa Fleming, our yoga extraordinaire. She'll be there. She's going to do a yoga group yoga practice for us, and the rock collage. Just things that are not traditional. That's why we really wanted to make sure it's about wellness, because a big piece of cancer prevention, because about 90% of breast cancer cases are due to environmental and lifestyle. And that's where we can take control of that. And part of that is stress management, ditching the plastic, caring about your cleansers. And then one of the highlights is we'll have a VIP gift bag for our sponsors, which I'll just shout them out in a second. TGIN, the hair care, they were founded by a person who had cancer, and she developed products. They're actually going to be the main sponsor of our gift bag. So they generously donated products for us, and it's those type of relationships that we want to promote, and have people out there to say, what am I putting in my hair? Does that make a difference? And it does. So
well, and that's an important point, because especially for Black women, we spent so many years, since probably childhood for a lot of us, straightening our hair. And now come to find out, all of these chemicals that we've been putting directly on our scalps year after year since, for me, the age of 9, cause things like fibroids and tumors and cancers. And, had we known then what we know now, we would have never done it, So I haven't relaxed my hair in many years, but the damage is already done. And that's the unfortunate thing. So for TGIN, that's a good brand. I use it as well. Awesome. And I know the story of the founder who had a valiant fight and created this product to help the rest of us. So,
and her niece is now the president, and she has created a foundation, and they actually help women that can't get to their appointments. They really focus on making sure that they're helping cancer patients. So they are definitely giving back, and they continue to give back. And that's why we were happy to have them as one of our sponsors. I can come back after, so we'll talk.
Okay.
And then, I do want to give a shout out to our sponsors, though. Go ahead.
Okay, Dr. Bobb-McKoy. So you are, obviously you said you are Caribbean descent. You're, a Black woman in medicine. Can you tell us really quickly about some of your the diversity or lack thereof in your field in particular? It's very hard to find a family practice practitioner who looks like me or who looks like Susy. It's very hard for us to find doctors who are of of any diverse background. So can you tell us about any efforts you're involved in, or your thoughts about bringing more of our people into the medical field?
Well, in Bergen County in particular, if you go to Essex County, it's not as hard. It's much more diverse in Essex County. But we're talking about Bergen County. And yes, we are few and far between as far as specialists and primary care doctors. A few years ago, one of the specialists actually held something in her office to try to bring together, physicians of color. So we would know who we are. So when people actually ask me, do you know of a Latina XYZ specialist? Do you know? I can have that information readily available to them. We haven't done that in a while, and that's something that I've been thinking about actually this year. Before
I can help you with that.
To try to get us all together in one room so that we know who we are, and it's a name to a face. It's not just sending somebody there. We can actually network and give each other our cards and information. As I said, we did that a few years ago, and that was actually a very successful, and I'd like to see that happen again. The one plug that I actually wanted to put in as far as breast cancer awareness, there's a Sisters Network for Black women who have, and women of color who have cancer. There's a Sisters Network, the Passaic Bergen County chapter. I think it was in Hackensack where they were meeting. I'm not sure, but it's about a sisterhood getting together, women survivors of breast cancer coming together and supporting each other. I can find out more information about that, or if any of you has that information, I think that would be extremely helpful.
Yes, 100%.
So as we close out, if we have any questions from those who are watching, please share them. right now, so you can have a chance to share that. So Susie, you had an upcoming event you also wanted to tell us about.
Yeah, so really quickly, the Englewood Municipal Alliance and Englewood being stigma free, they're having an opioid education series. So we partnered in collaboration with Community Baptist Church. So it's just a series on opioid education, since that is another public health issue. It starts this upcoming, not this Saturday, next Saturday, October 14th at 11 a.m. and lunch will be included. So, and it's a free event for everyone. So please, you can come out, be a part of the series, learn about opioid education and how to manage that.
Okay, thank you for that. That is another topic that needs a lot of discussion. You said that's on Saturday, October 14th at Community Baptist Church in Englewood.
Yes.
Okay.
I have the flyer, which I can share.
Okay, please do.
Yeah.
Add that. Okay, so final thoughts. So Danny, let's circle back. You wanted to give some shout outs?
Yeah, well, I just wanted to talk about putting events like this on. The one thing that we felt so blessed and we were grateful for were the sponsors that came out and really wanted to support us. The main one was All Health Medical Group and Dr. Bobb-McKoy's practice. They were, one of the first people to, wanting to sign on and support this. And they are going to have their doctors will be at our event. And we have Dark Cars, Lexus of Englewood. They will be auctioning off 2 toy cars at the event. We have Englewood Hospital is on board. And a special shout out to the National Coalition of 100 Black Women, the Bergen Passaic chapter. We went to their event on this past Saturday. It was amazing. I saw you there.
Very nice. Yes.
It was beautiful. And I just say them because they have supported us in the past and continue to support us, and we are really grateful for that. We also have to give a shout out to State Farm Tammy Felton, who always comes through. She's not even going to be at the event on Sunday because she has other plans, but she made sure to help us and support us.
Tammy helps everybody. She's so awesome.
We love her.
She might not go, but she's gonna help out.
And then we have some other supporters that have really helped us out. I'm gonna just say one of the people that actually helped us to put together the Doctor's Corner, which is very similar to something that Dr. Bobb-McKoy was speaking, and that's Edith Connor. She's a nurse at Holy Name Medical Center. And she, really helped us to pull that concept and the ideas together, and she recruited a lot of the doctors. And I definitely want us to speak about what you were talking about, because we would be 100% in for supporting a cross networking. And that was one of the reasons also that why we thought that this would be good, because we focused on Black and Brown doctors, so they could also find one another, so they would be able to give referrals to their patients. So this was definitely a group effort, so we appreciate it. And lastly, I can't stop without saying Tevra from Bergen and Color is one of our sponsors, and she
NJ in Color, girl.
NJ in Color. I'm sorry, I'm old school, so
I know. Retro.
You really helped to support us, and we really appreciate all that you do. So
no problem. The feeling is mutual.
Yeah.
So okay, so Susie, any last comments? No.
Please come out. This is a completely free event.
Yes.
Everything that you can think of will be covered. We even have organizations that will assist with Medicaid applications, Medicare applications, anything that you can think of, it's there. It's a free resource, free way to find a future doctor, a future PCP for preventive care.
Yeah.
Just please come out and enjoy.
And then we'll have delicious food trucks out there also.
Ooh, with healthy options, I assume.
Some, yes, healthy options. Yes.
Don't have fried food at the health fair. Come on now, Danny.
The parking lot is big enough to walk it off a little bit. So.
Exactly.
Okay, and I'm going to close out with Dr. Bobb-McKoy. Give us something good, doctor.
Give you something good. Come on out and you'll get something good. Come on out. Come on Sunday. And I will be there. All Health will be there. We'll have a few practitioners there, nurse practitioners. A few of our physicians will be there. So come on out, ask questions. Please have your questions ready for us, and enjoy and take advantage of the opportunity to come on out, because everything will be in one place.
Yeah.
So you can just walk up and down and peruse up and down and find probably everything you need regarding healthcare, health-related issues at the health fair. So please come on out, bring your family, bring your friends, tell everybody, and just enjoy Sunday, and come and take away the knowledge.
Yes. And it's a holiday Monday, so.
I know, no excuse. You don't have to work the next
Exactly.
day. It is Indigenous Peoples Day the next day.
Exactly.
So thank you for all of that information, ladies. Thank you for your time. And this is a family fun event. This is a free event. This is a bilingual event.
Yes.
Come out and enjoy the day and get some information and screening. And if you want vaccinations, we're not pushing it on nobody, but if you want to get them, you don't need insurance to get it. Come on out and take advantage of all these resources that have been pulled together in one place for the community, because this is for the community. Danny doesn't need it. Dr. Bobb-McKoy doesn't need it. Susy doesn't need it. But they're putting their time and their effort and their resources together to bring it to the people who would benefit from it the most. So come on out. I'll be there. And we're going to have a great, great day. Thank you guys for watching. If you have a question for Dr. Bobb-McKoy, she is located at All Health Medical Group in Englewood Cliffs. There's her information down below if you have any questions for the doctor. She is a fantastic doctor. She was my doctor for many years, and she's going to be my doctor again as soon as I get this insurance situation understood. So thank you all for your time. Thank you guys for watching, and thank you for connecting with NJ in Color as we connect you to the diversity of North Jersey. Have a good afternoon, everybody.
Thank you.
Thank you.
Thank you.